Welcome back, Jennifer here, your favorite speech therapist that is helping you become an amazing caregiver. Today we are cracking the code on the MoCA Cognitive Assessment. It's time to learn another one of the assessments I use to pinpoint deficits related to cognition and language skills in the adult population. A few months back, I did a video on the SLUMS cognitive assessment, which is the assessment tool I use most often with my patients to determine mild cognitive impairment and dementia-type deficits. You can find that video at the end of this one. Today, though, I want to go over the Montreal cognitive assessment, or the MoCA, as it's usually referenced. In my opinion, this informal assessment tool is more difficult than the SLUMS test and more sensitive. So that means that I can use it to find more subtle deficits that the SLUMS may not capture. I typically find myself using this assessment if I suspect that my patient may have more of a mild cognitive impairment because the questions on the test evaluate a wider range of cognitive domains. So, without further ado, I will read through the MoCA questions. Feel free to try this assessment yourself or have your loved one give it a whirl. Number 1. Draw a line going from a number to a letter in ascending order. Begin at 1 and draw a line to A, then to 2, and so on. You will end at E. Number 2. Copy this drawing as accurately as you can. Number 3. Draw a clock. Put in all the numbers and set the time to 10 after 11. Number 4. Tell me the name of each of these animals. Number 5. This is a memory test. I'm going to read a list of words that you will have to remember now and again later on. So I want you to listen carefully. When I am through, I want you to tell me as many words as you can remember. It doesn't matter in which order you say them. Face, velvet, church, daisy, red. Now, I'm going to read the same list for a second time. Again, try to remember and tell me as many words as you can, including the words you said the first time. Face, velvet, church, daisy, red. I will ask you to recall those words again at the end of the test. Number 6. I'm going to say some numbers, and when I am through, please repeat them to me exactly as I said them. 2, 1, 8, 5, 4. Now, I'm going to say some more numbers, but when I am through, you must repeat them to me in the backwards order. 7, 4, 2. Next, I'm going to read a sequence of letters, and every time I say the letter A, I would like you to tap your hand once. If I say a different letter, do not tap your hand. Here we go. F, B, A, C, M, N, A, J, K, L, B, A, F, A, K, D, E, A, J, A, M, O, F, A, B. Now, for the next task, I will ask you to count by subtracting 7 from 100, and then keep subtracting 7 from your answer until you have subtracted a total of 5 times. It's important that you do this entirely in your head. Do not write it down. Let me go over that one more time. So I'm going to have you count by subtracting 7 from 100. And then you're going to keep subtracting 7 from your answer until you have subtracted 5 times. Again, remember, do this in your head, not on paper. Number 7. I'm going to read you a sentence. Repeat it after me exactly as I say it. I only know that John is the one to help today. Now, I'm going to read you another sentence. Again, repeat it after me exactly as I say it. The cat always hid under the couch when the dogs were in the room. Number 8. Tell me as many words as you can think of that begin with a certain letter of the alphabet that I'm going to tell you here in just a minute. You can say any kind of word you want except for proper nouns like Bob or Boston, numbers, or words that begin with the same sound but have a different suffix. So something like, for example, love, lover, loving, things like that. I will tell you to stop after 1 minute. Now, tell me as many words as you can think of that begin with the letter F. Pause the video here and set a timer for 1 minute. Count up how many words you can come up with, and then we'll continue. Number 9. Now I'm going to have you explain what each pair of words has in common. For example, tell me how an orange and a banana are alike. You could tell me they are both fruit. Now, tell me how a train and a bicycle are alike. Now, tell me how a ruler and a watch are alike. Number 10. I read some words to you earlier, which I asked you to remember. I'd like you to tell me as many of those words as you can remember. Number 11. Tell me the year, month, exact date, and day of the week. Now, tell me the name of the place where you are and which city it is in. And that's the end. So, how'd you do? Just like the SLUMS assessment, you can miss a few points, 4 to be exact, and still be considered within normal range. I will leave an attachment in the description section for a printable copy of this assessment, along with instructions for scoring. If you haven't tried the SLUMS assessment yet, give it a try by watching this video. Then, compare your scores. And if you want to learn more about dementia, check out the video at the bottom. Caregivers, keep up the good work. Thanks for watching, and until next time, good luck cracking the code.